Living with sickle cell disease can be challenging, as it often involves managing chronic pain, fatigue, and other complications. However, advancements in medical research have led to the development of medications that can help alleviate symptoms and improve the quality of life for individuals with sickle cell disease. These medications play a crucial role in managing the condition and reducing the frequency and severity of painful crises. In this video, we will explore the top 5 medications that have shown promising results in managing sickle cell disease. Medication 1. Hydroxyurea. Hydroxyurea is one of the most widely used medications for managing sickle cell disease. It is an oral medication that works by increasing the production of fetal hemoglobin, which helps to prevent the deformation of red blood cells. By increasing the levels of fetal hemoglobin, hydroxyurea can reduce the frequency of painful crises and the need for blood transfusions. Numerous studies have shown the effectiveness of hydroxyurea in managing sickle cell disease. In one study published in the New England Journal of Medicine, researchers found that hydroxyurea reduced the frequency of painful crises by 50% and decreased the number of hospitalizations in patients with sickle cell disease. Additionally, long-term use of hydroxyurea has been shown to improve overall well-being and increase life expectancy in individuals with the condition. While hydroxyurea is generally well tolerated, it may have some side effects, including mild nausea, fatigue, and a decrease in white blood cell count. However, the benefits of this medication in managing sickle cell disease far outweigh the potential side effects. It is important to work closely with your healthcare provider to determine the appropriate dosage and monitor for any adverse effects. Medication 2. L-glutamine. L-glutamine is an amino acid supplement that has shown promising results in managing sickle cell disease. It works by increasing the levels of glutamine in the red blood cells, which helps to reduce the oxidative damage and inflammation associated with the condition. In 2017, the FDA approved L-glutamine for use in both children and adults with sickle cell disease. In a clinical trial published in the New England Journal of Medicine, researchers found that L-glutamine reduced the frequency of pain crises by 25% in individuals with sickle cell disease. The study also showed that L-glutamine decreased the need for hospitalizations and the use of opioids for pain management. L-glutamine is generally safe and well tolerated, with the most common side effects being nausea and diarrhea. It is important to note that L-glutamine should be taken under the supervision of a healthcare provider, as the appropriate dosage may vary depending on the individual's age and weight. Medication 3. Voxelotor. Voxelotor is a newer medication that has shown promising results in managing sickle cell disease. It works by increasing the oxygen carrying capacity of red blood cells, which helps to prevent their deformation and reduce the occurrence of painful crises. In 2019, the FDA approved Voxelotor for use in individuals aged 12 years and older with sickle cell disease. A clinical trial published in the New England Journal of Medicine evaluated the efficacy of Voxelotor in individuals with sickle cell disease. The study found that Voxelotor significantly increased hemoglobin levels and reduced the frequency of pain crises compared to a placebo. The medication was well tolerated, with the most common side effects being headache and diarrhea. Voxelotor offers a new treatment option for individuals with sickle cell disease, particularly those who may not respond well to or have contraindications for other medications. It is important to consult with a healthcare provider to determine if Voxelotor is an appropriate treatment option based on individual circumstances. Medication 4. Crizanlizumab. Crizanlizumab is a monoclonal antibody that has shown efficacy in managing sickle cell disease. It works by blocking the interaction between sickle cells and blood vessel walls, thereby reducing the adhesion and inflammation that contribute to painful crises. In 2019, the FDA approved Crizanlizumab for use in individuals aged 16 years and older with sickle cell disease. A clinical trial published in the New England Journal of Medicine demonstrated the effectiveness of Crizanlizumab in reducing the frequency of pain crises in individuals with sickle cell disease. The study found that Crizanlizumab significantly decreased the median annual rate of pain crises compared to a placebo. The most common side effects observed in the trial were nausea, arthralgia, joint pain, and back pain. Crizanlizumab provides a targeted approach to managing sickle cell disease by addressing the underlying mechanisms that contribute to painful crises. It is important to discuss the potential benefits and risks of Crizanlizumab with a healthcare provider to determine if it is an appropriate treatment option. Medication 5. Endari. Endari is an oral medication that has been approved by the FDA for use in individuals with sickle cell disease. It is a pharmaceutical-grade L-glutamine formulation that works by increasing the availability of glutamine, an amino acid that helps to reduce oxidative stress and inflammation in the red blood cells. In a clinical trial published in the American Journal of Hematology, researchers found that Endari reduced the frequency of pain crises and hospitalizations in individuals with sickle cell disease. The study also showed improvements in patient-reported outcomes, including a decrease in the number of missed school or work days due to sickle cell-related complications. Endari is generally well tolerated, with the most common side effects being constipation, nausea, and headache. It is important to work closely with a healthcare provider to determine the appropriate dosage and monitor for any adverse effects. Other treatment options and complementary therapies. In addition to the medications mentioned above, there are other treatment options and complementary therapies that can help manage sickle cell disease. Blood transfusions may be recommended for individuals with severe anemia or to prevent complications associated with sickle cell disease. Bone marrow transplants, while not commonly performed due to the associated risks, can potentially cure sickle cell disease in some cases. Complementary therapies such as acupuncture, massage therapy, and relaxation techniques may also provide relief from pain and improve overall well-being. It is important to discuss these options with a healthcare provider to determine if they are appropriate and safe for individual circumstances. Tips for managing medications for sickle cell disease. Managing medications for sickle cell disease can be challenging, but there are several tips to help simplify the process. Stick to a medication schedule. Set reminders or use medication management apps to ensure that you take your medications as prescribed. Communicate with your healthcare provider. Keep your healthcare provider informed about any changes in your symptoms or if you experience any side effects from your medications. Keep a medication journal. Record the medications you take, their dosages, and any side effects or improvements you notice. This can help you and your healthcare provider track the effectiveness of the medications and make any necessary adjustments. Stay organized. Use pill organizers or medication reminder apps to keep your medications organized and easily accessible. Follow a healthy lifestyle. In addition to medications, maintaining a healthy lifestyle can help manage sickle cell disease. This includes staying hydrated, eating a balanced diet, getting regular exercise, and managing stress. Conclusion: finding the right medication regimen for sickle cell disease. Living with sickle cell disease can be challenging, but there are medications available that can help manage symptoms and improve quality of life. Hydroxyurea, L-glutamine, Voxelotor, Crizanlizumab, and Endari are among the top medications that have shown promising results in managing sickle cell disease. It is important to work closely with a healthcare provider to determine the best medication regimen based on individual circumstances. In addition to medications, there are other treatment options and complementary therapies that can help manage sickle cell disease. By following a medication schedule, communicating with healthcare providers, staying organized, and maintaining a healthy lifestyle, individuals with sickle cell disease can enhance the effectiveness of their treatment and improve their overall well-being. Remember, everyone's experience with sickle cell disease is unique, so finding the right medication regimen may require some trial and error.